Hello everyone, my name is Daisy Wu. I'm a pharmacy student at Texas Tech University Health Science Center School of Pharmacy. Today I'll be talking about the Oppositional Defiant Disorder, or known as ODD. While I was on rotation, I encountered several pediatric patients with ODD. This piques my interest on learning more about this topic. So now let's jump right into it. The learning objectives for today are describe the oppositional defiant disorder etiology, epidemiology, and coexisting condition. Identify the diagnostic criteria based on the DSM-5 criteria for ODD. Classify the severity of ODD and describe the treatment option for ODD. First, we'll start with the patient case. Lisa is a 5-year-old girl whose parents asked their family physician to see her because of their increasing concern about her temper tantrums in the home. The parents indicated that Lisa often becomes enraged and argumentative with them, refusing to follow the rules or take direction. In particular, they reported difficulty getting her to transition from playing with her toys to coming to the dinner table. After Lisa ignored her parents' repeated prompts, her father became frustrated and told her that she had lost her dessert privileges. Lisa became aggressive and destructive, breaking her toys, smashing the food and water from the dinner table into the carpet. Her parents described similar scenario at bedtime, bath time, and when getting dressed in the morning. They described her as an irritable in these situations, and they felt that she's deliberately ignoring and trying to annoy them. The question that we have is, does Lisa have ODD? And if so, what would be our treatment plan be like for her? So first up, what exactly is ODD? It's a type of childhood disruptive behavior disorder that primarily involves problems with the self-control of emotional and behaviors. The main feature of ODD include persistent pattern of angry or irritable mood, argumentative or defiant behavior, or vindictiveness towards others. So what causes ODD exactly? The exact etiology is complex and is not very explicit. There are some theories out there, but that interplay between genetic, environmental, and psychosocial factors. No one really knows why ODD happens. Genetically, it was estimated about 50% of children inherit ODD from their parents. In one study, participants with low activity of the enzyme monoamine oxidase A, or also known as MAO-A, and who were exposed to childhood abuse were more likely to diagnose with ODD than individuals who don't have the traits. Changing cortisol level and abnormal neural findings that appear to also be involved in the etiology of ODD. Environmental factors such as childhood abuse and inconsistent parenting are commonly also found in families of children with ODD. Temperamental factors such as irritability, impulsivity, poor frustration, tolerance, and high level of emotional reactivity are commonly associated with ODD. These traits are often heritable. In addition, peer rejection, defiant peer groups, poverty, neighborhood violence, and other unstable social or economic factors are known to contribute to the developmental of ODD. Now you may ask, how common is ODD? The prevalence is varied with an estimate range from 2 to 11% of the pediatric population. This variation occurs due to various factors. These varying sources including varying sources of information, such as parents, child, or teacher report the symptom, the timing of diagnosis, whether it's current or retrospective, and whether the children meeting the criteria for the conduct disorder. ODD is rarely diagnosed in older children and adolescents. It's more common in pre-adolescent male than female with 1.4 to 1 ratio. Symptoms remain relatively standard between the ages of 5 and 10, and as the child ages, the prevalence declines. Pre-existing conditions are common in children with oppositional defiant disorder. The most common disorder is ADHD. Others include anxiety, depressive disorder, bipolar disorder, and conduct disorder. In a multimodal treatment study of children with ADHD, researchers found that 40% of children with ADHD also met the diagnostic criteria for ODD. When the children have most disorder, they are more likely to be, when children have both of these orders, they are more likely to have more aggressive, have more persistent behavioral problems, and experience more rejection from peers and have poor performance academically. So, how do you diagnose ODD? The Diagnostic and Statistical Manual of Mental Disorder, or short for DSM-5, has come up with the criteria to diagnose for ODD. The patient must meet at least 4 symptoms of the list below, and these symptoms should present in most days for at least 6 months. These listed symptoms include often loses their temper, often touchy and easily annoyed, often angry and resentful, often argue with authority figures such as their parents or children or adolescents, with adult, often actively refuse or defy to comply with the requests of the auditory figures or with rules, often deliberately annoys others, often blames others for his or her own mistake or misbehavior. The child has been spiteful and vindictive at least twice within the past 6 months. Patient must show evidence of impairment in form of distress and or negatively impacting social, educational, occupational, or other importance. And behavior do not occur exclusively during substance use, psychotic, depressive, or bipolar disorder, and they must not meet the criteria of disruptive mood dysregulation disorder. Now, if the patient has symptoms present in only one setting, this is considered a mild ODD. Moderate ODD is when symptoms are present in at least 2 settings, and severe is when symptoms are present in 3 or more settings. There are other diagnostic tools that can be used to identify ADHD, ODD, and other behavioral disorder. The first one listed here is the National Initiative for Children's Healthcare Quality Vanderbilt Assessment. This was designed for the primary care evaluation for children with suspected or diagnosed ADHD. It contains questions that aid the identification of ODD. SNAP-4 is not usually used to diagnose for ODD, but it can enhance detection of ODD as well as the other psychological concern. Last but not least, the Pediatric Symptom Checklist. This one is not specifically used for ODD, but it can look for cognitive, emotional, and behavioral problems, which then can help further investigate ODD. And the link of each tool are in this presentation. Please refer to them for more details. Now, so how do you exactly treat ODD? The treatment modality for ODD include parent management training, school-based intervention, individual child therapy, family therapy, and pharmacologic therapy. For parent management training, they use positive reinforcements to decrease the unwanted behavior and promote a positive behavior. Method includes teaching parents to identify behavior as well as positive interaction. Parents may apply the punishment or reinforcement as appropriate. Some notable PMT programs include the Webster Straton's Incredible Years and the Triple P program. These programs entail about the 2-hour weekly session for a total of 13 to 16 sessions, during which parents are shown video of the corrected and incorrect way of a child management and then asked to rehearse these approach, and they may complete these weekly activities at home with a progress report via telephone. Here we have some of the example for the parent training. These include like recognizing and phrase positive behavior. So if they did something good, then you want to compliment them. Avoid power struggles, set limits and enforce consequences, set up a routine so they can follow, ensure consistent and appropriate discipline procedure, learn a way to calm yourself, because I know sometimes with ODD it can be very stressful for patient and caregiver. Take time for yourself to de-stress and then be forgiving. Just know that sometimes the child are not doing this on purpose. So some school-based intervention includes supportive intervention to improve school performance, peer relationship, problem-solving skill, education and specific tools for teacher to improve classroom behavior, techniques to prevent oppositional behavior, and methods that facilitate adherence to classroom rules and acceptable social norms. For individual behavior, the most gold standard therapy would be the cognitive behavior therapy. Some examples include the coping power program. With this program, they also involve an anger management program that has it also has multiple platforms that consist of additional components for parents' involvement and periodic home visits. For pharmacologic treatment, I know medication alone has not been proven effective to treat ODD specifically. However, most of the time patients who are diagnosed with ODD, they do have a coexisting condition. Therefore, it's useful to help to control specific behavior and to treat coexisting condition. For example, if the child have ADHD, they will most likely be prescribed with a stimulant like methylphenidate, or even a non-stimulant like atomoxetine, guanfacine, or clonidine to control their symptom of ADHD. And also, if they coexist with depression, you can treat with SSRI or SNRI. By treating the underlying coexisting condition, it can decrease the event of aggression and symptoms of ODD. So let's go back to our patient case. So Lisa, she shows some signs of ODD, and I highlighted here. These include like her temper. She has temper tantrums while she's at home, and when her parents try to talk to her, she will be very angry and she will try to argue back, and then she refused to follow the rule or take directions. And once her dad tried to discipline her by saying that like you lost your dessert privileges, she became more aggressive and destructive and started breaking her toy and smashing her food. So then now, do we know that she has, before diagnosing her with ODD, there are some questions that we need to ask. So how long has Lisa been acting like this? What other setting have the parents noticed this behavior, and does she have any other coexisting condition that can escalate her ODD symptoms? Well, if Lisa does have these symptoms for the past 6 months for most of the day, the physician may diagnose her with ODD. Some treatment plans for her can include, let's try to treat the underlying cause. For example, if Lisa does have ADHD, we will continue medication like Ritalin to sensitize her symptom. Cognitive behavioral therapy would also be beneficial, as well as the parent management training. So in conclusion, first-line treatment would be the psychosocial intervention, and then that will treat the underlying cause and coexisting condition, and be patient when you are a caregiver of a ODD patient. And here are my references, and I hope you enjoyed the presentation. Thank you.